This is a section of breast with inflammatory breast carcinoma. Here's the overlying skin, the breast tissue beneath, and skeletal muscle. Inflammatory breast carcinoma is a clinical diagnosis based on a swollen erythematous breast with skin thickening. Typically, there is no palpable mass. The underlying tumor is usually poorly differentiated and infiltrates throughout the breast, which you can see here. Lymphatic involvement and blockage by infiltrating tumor causes the edematous, swollen appearance. The skin has been likened to an orange peel, and the French term peau d'orange is used to refer to this appearance. Diagnosis may be delayed since this condition mimics a superficial skin infection. Histologically, most inflammatory breast cancers are ductal. Overall, 5-year survival is less than 50%.